Okay, Journal 7, Week 7. I've tried to record this now 4 times. So name a specific event, interaction, never seen before diagnosis that you experienced in clinical this week. I have seen this diagnosis before, but I didn't diagnose the patient with it. That's the thing. So the patient's addicted to drugs, addicted to Adderall and benzos, and then wrote a whole explanation on me how I didn't give her those medications, which I'm completely okay with. But then I realized when I looked at the notes and I looked at her notes and I looked at her complaints, she was taking 120 of each benzos and Adderall at a time. So definitely addicted to drugs. Never did see her again. But I've seen plenty of people that have been addicted to drugs, but I've never been attacked by someone who was addicted to drugs because I wouldn't give them to them. So I would say this had a huge impact on me, increasing my understanding of not giving patients medications even if they tell on you, or if they want the medications if they're not safe for them. So how did the pathophysiology provider relationship? So I immediately was on guard with this patient because she wanted those medications, and I think that definitely affected our appointment. But I think that I was okay with being on guard with that, and I'm actually okay with the whole interaction with that patient. Personal strengths and limitations and their effect on the provider. I think that I didn't have a lot of compassion for the patient because I knew what she wanted. So I think that definitely I had no therapeutic with the patient, which I probably do need to figure out how I'm going to have to deal with that because it's going to come up a lot. So I'm going to try to figure that out. I don't know how to deal with someone who demands medications from me who are dangerous and I don't agree with. So unfortunately, it does show on my face. It shows all over my face, all during the appointment. She said I made a snide remark because I didn't, but she said, well, I have uncontrolled hypertension, but she's on 120 Adderall a month. So I don't think there was a conversation about that. I think it was just probably something that I was shocked over. I think I could say that I've learned from this experience, and what it's taught me is that I don't agree with the medications that the provider before me gave this patient. I honestly feel like I would do the same thing all over again. I may not act as surprised, but I don't think that I would do anything different. Something specific I learned is that people will do anything for these type of medications, including try to say that you're not a good practitioner because you didn't give them, which is awful, but at the same time, I wouldn't do anything different with that interaction. Maybe not be as surprised when she told me that she had uncontrolled hypertension and that she sees cardiology. And I think maybe the look on my face, because I don't remember saying anything to her. I just said, well, I don't understand. If you have hypertension, you're on 120 Adderall a month. And I just said, I don't feel comfortable prescribing those medications, so I am going to send you somewhere else. Patient was not happy with me. And I do think I learned a lot from this. The fact that people will do anything for these kind of medications, and that I didn't want to see the patient to begin with. But somehow I'm going to make sure that that's not on my schedule ever again, and make sure that the front desk knows not to give that to me ever again. I feel like that was, I think, the miscommunication is I didn't want to take patients that wanted controlled substances, and we don't do that. but yet I still got the patient, and then this is what happens, was a bad interaction. So what did I learn? That I'm probably going to look for another job and not have interactions with patients that want these kind of medications. And I would do it all again, and I would do the same thing for anyone.